is a surgical procedure where the hip joint is replaced by a prosthetic implant. It consists of replacing both the acetabulum and the femoral head. Total hip replacements are currently the most common orthopedic procedure, although patient satisfaction varies. Here is an example of what a total hip replacement looks like. The two main goals of the total hip replacement are to reduce or eliminate pain and restore function by improving movement of the joint. Following your hip replacement procedure, you will have a few important hip precautions to follow to ensure a good recovery. Occupational therapy is a skilled service that you may find beneficial following your hip replacement. Therapists will work with you on proper seating positions, the use of a walker, and provide and teach you how to use dressing equipment. They will also work with you to teach safe techniques for getting in and out of bed, toileting, and bathing. Hip precautions are advised to refrain from adding stress on your hip joint while healing. You should follow these precautions until your physician tells you otherwise. Let's go look at some demonstrations of your hip precautions. First, avoid bending past 90 degrees. Second, avoid twisting your leg inward or outward. Lastly, avoid crossing your legs. To review, following your surgery, you may find that some of your everyday activities are now more difficult than before. We're going to demonstrate how to complete some of these activities while following your hip precautions. Let's start with sitting. You should sit in a firm, straight-back chair with armrests. The chair should also be above knee height. You should not sit on soft chairs, rocking chairs, sofas, or stools. Feel for your chair with the back of your legs. Reach for your armrests and lower yourself down, keeping your operated leg straight out, putting your weight on your good leg. Do not bend forward. Now let's practice standing. Scoot your bottom to the edge of the chair so that your feet are flat on the floor. Bend your good leg under you to hold your body weight while keeping your operated leg straight out in front of you. Do not bend forward. Now use your hand to push off the surface and put most of your weight on your good leg. Your physician will let you know how much weight you'll be able to bear on your operated leg. If your doctor deems you non-weight bearing, then you should not attempt standing or walking. You may choose to use a walker to make getting around easier. Once you are standing with the walker placed in front of you, move the walker first and then step with the operated leg. Push down on the walker when stepping with the operated leg. Be sure to use a heel-toe pattern when walking. Do not turn or pivot. Instead, pick up your feet and turn using several small steps. Getting into and out of bed will likely become a challenge while following your hip precautions after your total hip replacement. Start by sitting down on your bed in the same manner you would sit on a chair. As with the chair, your bed should also be the appropriate height. Make sure that you do not bend forward and that your operated hip is not turning in. Bear your body weight through your arms and hands and scoot your hips backwards onto the bed. Lower yourself onto your forearms and pivot on your bottom as you lift your legs onto the bed. Keep your operated legs straight and your toes pointed up. While lying in bed, lay on your back with a pillow or two between your knees. Do not allow your operated leg to cross the middle of your body. You can also lay on your non-operated side with 2 or more pillows between your knees to prevent crossing your legs. To get out of bed, slide your legs toward the edge of the bed, keeping your operated leg with straight knee and toes pointed up. Next, push onto your hands and slide your legs to where your heels are just over the edge of the bed. Scoot your hips forward until both feet are flat on the ground. Be sure not to bend forward and prevent your operated hip from turning inward. Do not bathe or shower until approved by your physician. Following approval, it is recommended to use a shower bench that extends over the side of the tub to help you bathe safely and maintain your precautions. Again, the chair should be the appropriate height so that your feet can rest flat on the floor of the tub. Begin by standing with your back towards the bathtub and slowly lower yourself onto the shower bench. sliding your operated leg forward as you sit. Lean your trunk back as someone helps you to lift your operated leg over the edge of the tub. Slowly slide back and make sure you are in a safe sitting position. To get out of the tub, have someone lift your operated leg out of the tub and place your feet flat on the floor. To use the toilet, use a raised toilet seat that is at or above knee height. Use the same sitting technique as taught earlier. Do not twist your trunk to wipe, instead reach behind. Upon release from the hospital, you may receive a hip kit that will help you with everyday activities such as bathing, dressing, toileting, and retrieving out-of-reach objects. Your kit may include a long-handled bath sponge, sock aid, shoehorn, a raised toilet seat, reacher, and a dressing stick. The occupational therapist will help you learn to manage daily activities and teach you how to use your new equipment. The adaptive equipment helps you to follow your hip precautions safely. You may find it difficult to dress yourself while on hip precautions, especially your lower body. To make it easier, make sure that the items necessary for dressing are within reach. To avoid bending beyond 90 degrees and twisting, you may need to use your reacher to retrieve certain items. To dress your lower body, always dress your operated leg first. Begin by using your reacher to pinch the waist of your pants. Lower the garment to the floor and slip it over the operated leg first. And then the other leg. Use the reacher to pull your pants up and over your knees. Stand up as previously described to pull pants up and over the hips. You can sit back down to button or zip them. To put on your socks and shoes, you will need to use your sock aid and long-handled shoehorn from your hip kit. First, place the sock all the way onto the sock aid. Make sure that the heel of the sock is at the back of the aid. Holding the sock aid by the cords, lower it down in front of your foot. Slip your foot into the aid with toes pointed down. Pull the straps upward to slide the sock onto your foot. Continue to pull until the sock is completely on your foot and the aid slides out of the sock. Following your total hip replacement, it will be important for you to wear proper fitting shoes that will support your ankles. Pinch the tongue of your shoe using your reacher and line the shoe up with your toes. Place your foot into the shoe and using your long-handled shoehorn, slide your heel in. It is usually best to wear shoes with elastic laces, Velcro straps, or slip-on shoes with a closed back. A total hip replacement and recovery can be an overwhelming experience. The most important thing is to remember your hip precautions to allow for optimal healing and recovery of the joint. Let's take a moment to review them. Don't be afraid to ask questions or for assistance from your physician or therapist as needed. We hope this video provided you with helpful tips on how to manage the recovery of your hip while performing everyday activities. The two main goals of a total hip replacement are to reduce or eliminate pain. The two main goals of a total hip replacement are to reduce or eliminate pain and restore function by improving the movement of the joint. Following your hip replacement procedure, you will have a few important hip precautions to follow to ensure good recovery. Occupational therapy is a skill service that you may find beneficial following your hip replacement. Therapists will work with you on proper seating positions, the use of a walker, and provide and teach you how to